Many people think lipo is only for women, and this couldn't be further from the truth. So a significant percentage of my patients are male patients, and whether you're a male or a female, it makes no difference. At the end of the day, if you have fat deposits around your body, you can't spot reduce these areas through exercise and diet, whether you're a male or a female. And the only way to get rid of permanently these stubborn areas of fat is through liposuction. So men certainly can and do get liposuction. So what are the common areas that my male patients get with liposuction? So the most common areas are upper lower abdomen and love handles, the male chest, if they're suffering from gynecomastia, and also the upper and lower back. Now the back regions on how we target it on a male patient is very different to a female patient. So on a female patient, when you're doing the upper and lower back, you're trying to make the area as slim as possible to make the upper torso frame only as big as the musculoskeletal frame allows. Now in a male patient, you want to accentuate the V-taper, so you're not trying to reduce the actual width of the upper back, but the upper back actually is where the pectoralis and the latissimus dorsi muscle meet. In between, if you get very lean, there is a triangular area of depression. Now, if you have a bit of excess body fat, that depression area, instead of being depressed, actually becomes quite full of fat and protrudes. So by removing that fat there, you're able to separate between the pec major and the latissimus dorsi to make the muscles appear more separate and defined. And the lower back continues that down into the waist, where even in a masculine frame, you're trying to accentuate a broad shoulder to waist ratio. So getting rid of the lower back fat helps in that. Let's talk about a topic that many men feel uncomfortable talking about, and that's gynecomastia. So what gynecomastia is when there is an abnormal presence of breast tissue, breast gland tissue behind the nipple in a male chest. So not only from a visual perspective, it can look a bit embarrassing, but also it can be quite sensitive. So when you're playing contact sports, pressure to the area can cause some discomfort. Now, contrary to what you sometimes see in social media, fitness influencers, if you actually have true gynecomastia, this is not a fat issue, so no amount of training and dieting will get rid of this. The only way to get rid of gynecomastia is to actually surgically get rid of it. Now, historically, because gynecomastia is a presence of abnormal breast gland tissue behind the nipple, surgeons used to just cut this gland tissue out. That was fine, but what invariably happens if you perform the surgery just by removing the gland and not performing liposuction around the area is that when the chest is contracted or the arms are raised, you invariably see a little bit of a crater deformity behind the nipple where the nipple inverts in. So it's only when you do liposuction around the fatty tissue that has been surrounding the gland tissue that you're able to get a smooth chest surface that doesn't concave in even when you flex your chest or have your arms above your head.